Hi everyone, welcome back. Today we're going to talk about gummy smiles. And if you think you have a gummy smile, then this video is for you. Please check it out. We're going to talk about the different types of gummy smiles and the ways to treat them. So I will try to make this video quite simple, just so you can understand it better, and I will try to show you pictures along the way so you can see the different types of gummy smiles along the video. So to simplify the matters, there's two types of gummy smiles. The first one is the gummy smile where the patient, when they smile or talk or laugh, we can only see half of their tooth crown. What this means is that the gum is covering the other half of the tooth crown. So the tooth crown is not exposed fully. As you can see in the photo, the tooth appears quite short. All of the teeth appear quite short because this is the type of gummy smiles where the gum goes over the portion of the tooth. And the second type of the gummy smile is the one that the full crown of the teeth are the full crowns of the teeth are exposed, but the patient has gums on the show when they smile or laugh, or sometimes when they even talk. And by the way, if you feel like you have any questions during or after this video, please list them down below and I will do a part 2 video answering all the frequently asked questions at my clinic about this topic, as well as include your comments on that too. So let's get to the part where we talk about the treatment options for gummy smiles. So we get a lot of patients asking us, especially lately, I have a gummy smile, can you just take out some gum and, everything will be fine and I will not have any gum on show? Well, there's a problem with that. If you have the first type of the gummy smile, where the gum is covering half of the tooth, we can definitely do that. We can take out gum, and if we see that the bone level is there, we can take out some bone too, just to ensure that the gum will fit nice and sound around the bone. But if you have the type of gummy smile where you have the full crown on the show but still have a gummy smile, then that case will be a little bit of a problem to treat, and I'll tell you why. If we try to take more gum and bone out of the areas where the roots of the teeth are supposed to be, because we just said that the crowns are fully exposed, so we're taking out some gum tissue and bone tissue on the areas where you have roots of the teeth. What happens is your roots of the teeth are going to be exposed, and whatever we do aesthetically then on top of your teeth, they are going to appear elongated. So they're going to appear like you have very tall teeth, So a lot of the times when we see severe gum on the show on patients that don't have this tooth covered by the gum, but they just have the full tooth on show, but also the gum on show, a lot of the times we do refer to a maxillofacial surgeon. A lot of these cases, and I'll show you a picture on the screen, picture of my patient on the screen, that in her case she would need a maxillofacial surgeon to reposition the jaw backwards. That way, not a lot of gum will show. All of these that I mentioned, they are very invasive treatments. Okay, we're talking about removing gum and removing bone, but there's a non-invasive treatment to this, and that is Botox treatment. Yes, I said Botox. And I'm not talking about the Botox to make your lips big or full or, change your lips per se. But we're talking about injecting a little bit of Botox on the inner portion of the muscle of the lip, so that when you smile, your lip doesn't pull up that much, and as a result, you won't have so much gum on show and you won't have a gummy smile. So this is basically non-invasive, and compared to all the invasive procedures that I spoke about, the only thing with Botox is that it will have to be reapplied, of course, in a 6-month basis, because of course, as you might know, Botox doesn't last forever, so you might need to go in and have the Botox reapplied so that you can continue smiling without any gum on show. So yeah, there's options out there to treat the gummy smile, so make sure you talk to your dentist about this and see what they would be able to do for you. If you feel like you're a case of a severe gummy smile, then it's best to seek help from a professional on the area. So normally these procedures are done by periodontists, which are specialists of the gum and bone tissue, and maybe your dentist can even refer you to them. So seek the professional help that you might need, and yeah, that is it. Thanks for watching, and see you next time.